Sergio Barajas is about to undergo a rapid detox procedure.
I know I'll wake up. I know they'll wake me up, but it's just that's mainly what really gets me scared, that I might not wake up. But if I don't, I don't.
A few deaths have been reported in rapid detox procedures, but the Waismann Institute has never lost a patient.
This is a very safe procedure. This is safer than having to kick on your own if you were kicking at home. The procedure is done in the intensive care unit. We have all the fancy monitoring. We have a blood pressure monitor, an EKG monitor. We measure the oxygen in your blood. We even measure your brain waves to make sure you're asleep and to make sure you're getting the exact amount of anesthesia that you need.
Sergio has now been under anesthesia for 10 minutes. Doctors put him under to prevent dangerous withdrawal symptoms.
He's going through withdrawal. That's why he moves a little bit. If he did not have anesthesia at this point, he would be shaking and in great pain, throwing up, and all kinds of symptoms that they go through when they have withdrawal. A drug called Naltrexone, or Revia, has been put in his body, and it is pushing all the heroin off of the receptors in his brain and switching it with the Naltrexone. The Naltrexone acts as a blocking agent. It gets into those receptors, but instead of activating the receptors, it blocks them. It's kind of like putting a key in a lock that's been broken in half. It goes into the lock, but it doesn't activate it. The first time you give the Naltrexone is when all the reactions take place. And once the Naltrexone's on the receptors, you just have to keep maintaining it onto the receptors, which is why you take the drug every day.
Naltrexone is used to block the opiate receptors in the brain. Another treatment, called methadone, is used to wean heroin addicts off the drug by blocking heroin's effect for 24 hours. Methadone is a heroin substitute that is provided to addicts only in clinics. But like heroin, it's also addicting, and doctors can use rapid detox to treat it.
It's very much a heroin-like drug that you'd use once a day. So every morning the patient will take their methadone, and they'll be able to last the whole day because they have narcotics in their body for the whole day. If somebody misses their methadone dose, it's like missing your heroin dose. The withdrawal is very severe.
Dr. Bernstein says most heroin addicts aren't used to treating their problem in a hospital.
Heroin addicts are not treated as patients. They're treated as social outcasts. They're treated as criminals. Either they're thrown in jail or they're thrown into a detox center, and the detoxification process is miserable. I've heard from rehab centers and people that treat drug addiction that people have to go through a hard withdrawal in order to appreciate being clean, which is, it makes no sense to me. And we don't make people that smoke cigarettes suffer heart attacks to prove that they shouldn't have smoked cigarettes. We never do that.
I've been at work all day. I just got here, so I don't know the whole deal. I'm just going to find out what's the status, and I'm kind of nervous.
Betty will soon learn if this treatment will help Sergio beat his heroin habit, so they can begin to put their lives back together. Sergio Barajas is just leaving the hospital after undergoing a rapid detox procedure for his heroin addiction.
Right now, not opiate dependent. You're free from drugs, and there's no cravings. Is that correct?
No cravings.
Which, that's really the miracle. That's what people can't believe. And after they're finished, even if they don't feel good, they can't believe that they don't have cravings. So all you have to do now is just eat a little bit of food, keep eating little bits of food throughout the day, and you'll notice that you get better every few hours. Tomorrow will be a big difference from today, and even today you feel pretty good. So you're going to do great. And just take your Naltrexone every day and keep the cravings away.
Well, the first couple of days when I got out of the hospital, I was a little sore. I felt like I had run miles and miles, and but every day that went by, I was feeling a lot better.
The most noticeable thing Sergio is going to be experiencing is that all his senses will be heightened. In other words, he's pretty much had a blanket over his brain for the last 3 years. And when you take away the opiates, actually people even describe their vision as better. They'll say, oh, boy, I never thought life was this beautiful.
Betty is proud of Sergio for taking such a big step to get clean.
It takes a big person to do that. You know, being on the other side, I don't know how he feels, what he does, what his emotions are. So that's why I try to research to see how much I can do for him.
2 weeks later, Sergio still isn't using heroin. But just a few days after his follow-up appointment at the Waismann Institute, Betty's father was diagnosed with life-threatening cancer. Betty's now staying at her father's home, and Sergio is often left alone.
I do miss Betty right now because she's not, like, really there. she's been spending a lot of time with her dad, and but I understand her, so I've been just staying strong, you know what I mean? Trying to support her too, you know, what she's going through.
Even with the family crisis, Sergio says he already notices a positive change in his home life.
It was just like a war zone in here. And right after the rapid detox, it's like we don't argue, we sit down and talk. And she listens to me now. Between me and Betty, everything's been a lot better, a lot better. She's like real happy, dude, real happy. And my kids, you could tell the difference on them. I guess they noticed me and Betty real closer to each other than before. Before, I would just come home and sit on the couch, just watch TV and forget about the world. And now, it's like I come home, I have my dinner, and I throw the kids on their bikes, and I jump on my bike, and we go around the block, and we do a lot more things than before.
Sergio takes Naltrexone every day, and he's optimistic about his future, but he's reluctant to say that he's cured.
I guess I'm gonna say I'm cured until after the 9 months are over, because that medication takes my craving away. So you could say I'm still not doing it on my own, not until the 9 months are over, you know what I mean? But I'm sure it's gonna work.
Without heroin to shield him, Sergio has to face the day-to-day stresses of life.
It's a little more stressful, I guess. Seeing things the way they really are now.
Even with the stress, Sergio is happy to finally be free from his heroin addiction.
Everything's a lot easier for me. Everything, my thinking, everything, my movements, everything's, they did take off a heavy blanket off me, man. It's great.